Developing tonight, setting the record straight on the coronavirus. The disease has now spread to 28 countries, killing more than 600 in China. And tonight, a team of Yale doctors are confronting this outbreak and are sharing what we need to know to stay safe. Channel 3 Eyewitness News reporter Matthew Campbell is live for us at Yale tonight. And Matthew, I think the big question everyone wants to know is, when is this either going to peak or end?
Yeah, Aaron, and that's one thing that doctors really can't say. This coronavirus is brand new, so our body's immune systems really haven't built up defenses against it. And so right now, doctors really have no point of reference as this critical research continues. Kai Chen is a Yale climate change professor and has worried family and friends back in China who are already isolating themselves.
Outsiders, they cannot enter in this village.
The rural town he's from is more than 550 miles away from Wuhan. That's like the distance from Connecticut to Cleveland.
They are wondering when the life will go back to normal.
While that remains unclear, Yale doctors held a forum trying to clear up a lot of misinformation around the coronavirus. First, they say the origin came from a mammal, like a bat, not a snake or fish.
This is not a deliberate release from a laboratory.
But it is powerful, not as easily transmittable as measles, but more than Ebola.
It's comparable to SARS. It's more than the flu.
We were surprised to hear doctors say preventing it is just as simple as how we try to prevent the flu.
Hand washing and, coughing into your elbow.
In the U.S., we've already seen a run on masks.
There's no evidence that wearing a mask is going to keep you from getting it.
But with the death toll and amount of cases multiplying in China, a sense of panic has spread around the world. With the coronavirus now in 28 countries, doctors say that's understandable.
I think that we need to acknowledge that we have to try to make sure that nothing bad happens. The risk right now seems limited, and acknowledge that we don't know what the future holds.
What's most frightening is that doctors say it can take up to 10 days before patients actually exhibit symptoms. So many have it and could be spreading the coronavirus without even knowing it.
The most important thing is to figure out how soon after you get infected before you can transmit.
Yale doctors say with SARS, only people with symptoms were infectious. Pinpointing if seemingly healthy people can spread the coronavirus before symptoms show will be crucial in containing this.
If that is true, if that is really common form of transmission, which we don't know, this is going to make it much harder to control.
Now, there are some positives here. Doctors do stress that in healthy people, the symptoms just are not as severe. They do admit that this is a lot worse than the common cold and the death toll is higher. But again, if you are a healthy person, they just are not seeing severe symptoms. That's the latest live here at Yale. Matthew Campbell, Channel 3 News.